Yes, absolutely. So yeah, so like I said, allow me to correct you a second. The citizens petition was filed by a law firm in Florida who is currently engaged in litigation with Bayer. The FDA did respond to the citizens petition, and they have closed it. So they are not reinvestigating, at least to the best of our knowledge, anything. What they did is transfer the petition to the CDRH, which is the Center for Device and Radiologic Health, Office of Compliance, which is a normal process that is done. But at this point in time, to the best of our knowledge, the FDA is not currently investigating anything. And we absolutely disagree with all the allegations in the citizens petition, and Bayer will vigorously defend ourselves in this. I cannot we do not see any situation. The data is correct, at least to, again, the best of our knowledge. We have been able to review some of the records from those women that are alleging that their files or their reports were altered. However, when we review it, absolute good clinical practice and the proper processes were followed. Any errors that were made were crossed out, initialed, and dated, and that is standard when mistakes or things have to be changed in a report. So for what we see, everything was done by the book, processes were followed, and good clinical processes were adhered to. I'm sorry, could you repeat the question about training on removal? I left my cell phone here. I want to take this off so we don't have a problem. Well, so we don't specifically train on the removal of the device. The device is a permanent contraception, so it really wasn't designed for removal. However, in our instructions for use, or the labeling for Assure, there is information on how to go about removing it if necessary. We also have information on when it's indicated for removal. So we don't have any specific like simulator training or things like that on removal, but that is just surgical skills that are used. We provide the physicians with the information necessary, and we have a large number of support processes available for physicians should they have questions about what is the best approach for removal, what are the different techniques I should use. So we do offer as much support as possible. Well, the product has already been proven to be safe and effective through its rigorous clinical trials. The product has been available on the market since 2002, so well over a decade of use. There's over 750,000 women worldwide who have received Assure. And if you look in the literature, there's a large number of studies, both company-sponsored as well as independently done studies. And all the data that has been looked at, analyzed, reviewed, which not only by our company Bayer, but also by the FDA and European authorities, all show the exact same thing. Assure is safe and effective. We never say, or it's never been touted as being 100% effective. There is a failure rate. It is a very low failure rate as long as everything is followed properly during the placement procedure, the follow-up that the patient needs to do, getting the confirmation test at 3 months. If that occurs, the failure rate is extremely low, but unfortunately is expected. There's no method of contraception in the world or available that is 100% effective. As far as the adverse events go, again, we sympathize with any woman who has experienced an adverse event on any of our products. However, they are expected. There's a surgical procedure associated with placing Assure, and these things are expected to happen. They're very clearly stated in the labeling. They're very clearly stated in the patient information brochure, and we go over in extensive detail during our robust clinical training programs to inform physicians on the appropriate counseling, patient selection, what their patients can expect, and what are the rates of the adverse events. But again, when you look at the totality of the data, the rates, not absolute numbers, because you can't just talk about an absolute number when you're talking about adverse events. You have to look at the rate. When you look at the rate of adverse events, they are well within the lines of what would be expected with this type of product and procedure. Well, you cannot compare Assure to those type of contraceptive methods. Assure is hormone-free, so there are no hormones in it. When you talk about birth control pills, IUDs that contain hormones, you are now going to have a different type of adverse event. We do not have, so the only real comparator that could be used is laparoscopic tubal ligation. Now, we do not have any true prospective, in other words, forward-looking studies head-to-head against Assure and laparoscopic tubal ligation. However, and this is very important for everybody to understand, when you look at the adverse events that can occur with laparoscopic tubal ligations from studies that were done many years ago and all the data that's been analyzed over the years on it, you find a very similar rate and pattern of type of adverse events, such as pain, bleeding, etc. So what we are seeing, what the FDA is seeing, what all of our physician experts are seeing, and all those physicians who have a lot of experience with Assure, the rates of adverse events are what is expected. They're low, but again, they are expected with this type of procedure and this type of device. Well, first of all, I want to clarify that because hysterectomy is not necessary for removal. It is very important to understand that some of the symptoms that women would experience after getting Assure could be related to other pathologies or other causes. Sometimes a hysterectomy would be indicated, but not really for Assure, could be for another reason why to help treat the patient. But if it's purely felt that the adverse event is due to Assure and that Assure needs to come out, absolutely does not need a hysterectomy. We talk with many of our experts, many of our consultants who have a lot of experience with Assure and who have treated thousands of patients. And they tell us flat out, do not need to do a hysterectomy. There's other techniques to do it. We do state what those techniques are. It's either opening up the tube and removing Assure, or you can remove the tube in its entirety. But with that, it's surgical skills that are utilized. It's not something you can say, all right, this is the exact steps to do. Every woman's anatomy is a little different. Certain reasons why you're going to remove Assure necessitate a little bit of a different approach. So the best thing that we can offer is that if a physician calls us and has a question on what is the best approach to remove it in my specific patient who has this particular adverse event, we put them in contact with one of our experts who can then walk them through it and impart to them what the best approach is. So we do offer support that way. No, I said, so we offer that type of support. I'm sorry. So let me clarify that a little bit. A few years ago, we were saying, or a year ago, I'm sorry, we were saying 750,000 units were sold. Based on the units that have been sold now and looking at a variety of factors. So for example, when a unit is sold out of our distributor, we cannot say for sure that that unit is going into a specific patient. Some offices may order 2 or 3 kits. They keep one on backup in case, sterility is broken on one when they open it up, or, for a variety of other reasons. When you have large institutions like Kaiser, Cleveland Clinic, those places, they will order in a large bulk, and then they distribute it out to their sites. So it's really almost impossible with devices to get the exact number of women. But when you look at whether the returns or what we believe is what's called, stocking, we feel very confidently that now we can say approximately 750,000 women have received Assure worldwide. As far as the second part of your question goes, no. Yeah, so the second part of your question, we absolutely track the adverse events. So any patient, any physician, whomever calls us and says, I have an adverse event, or I'm a physician, my patient had an adverse event, we do record that, and then we report that to the FDA. The FDA's database, which is the MAUDE database, we don't have an exact, and it's impossible and really not fair for me to give you an exact number right now, because it's not going to be totally inclusive. And that's what I was getting to, is because the FDA, that they also will take adverse events directly, they may have a different number than what we have, because a patient or a physician could call the FDA directly and not call us. So all that we can report to the FDA is what we have. It's really the MAUDE database that is going to be a little bit more comprehensive, because they're capturing not only what comes into us as a company, but they're also capturing what comes in directly to them. But the adverse event rates that we're again, it's almost going to be impossible for me to give you that type of number. It's not going to be a very accurate number, again, because the MAUDE database is going to have more comprehensive information. What I can tell you is that the rates that we're seeing, that we send to the FDA, we are in constant contact, not only for Assure, but with all of our products, as with every other company is the same thing. The FDA has never given us any information or any concerns that they are seeing an abnormal signal. In other words, a higher rate than what would be expected. And in fact, the FDA confirmed that at the end of 2013, where they made a statement that, yes, there are adverse events, but what they're seeing is consistent with what would be expected. And that's really the most important thing to understand. No drug, no device, no medical procedure is without adverse events. The important thing is to constantly follow and constantly monitor and constantly analyze what are the adverse events coming in, and are or is any signal being detected that an adverse event is where it shouldn't be, you wouldn't expect it, or that it's at a much higher rate. And again, I have to stress this, from what we're seeing, from what the FDA is seeing, from what our experts are seeing, all points to the same thing. Assure is a safe and effective method of contraception. If a woman has a known nickel allergy, I would not recommend that she have Assure implanted. You're correct in what you had said. Yeah. The reason why the contraindication was removed was because of the fact that a study was done a number of years ago looking at the MAUDE database and trying to see women who had a positive skin test, which is the classic test for determining allergies, did they have a reaction to Assure? There were some women who had a positive skin test and did have reactions that would be consistent with an allergic reaction. However, and this is important to understand, there were a number of women who had a positive skin test and did not have an allergic reaction. And also the converse. There were women who did not have a positive skin test, but then who did have some adverse event that looked like it was consistent with an allergic reaction. And also there were women who didn't have a positive skin test who didn't have it. So what the FDA looked at that and said, well, should we be exposing women to unnecessary testing, which is the skin test, where the physician gets the result but cannot determine or say, yes, you are going to have it or you're not going to have it. So what has been done is the warning section, very extensive and detailed, talks about nickel, and basically it comes down to the conversation between the healthcare provider and the patient. If she has any concerns about nickel, then we would not recommend that that patient get Assure. Unfortunately, it does not mean that she would or would not have a reaction. Absolutely. It is very clearly stated in our labeling, patient information brochure. We train our physicians on that. This is when it comes to proper patient selection, counseling, etc. And we do tell our physicians, absolutely, you have to talk to her about nickel, and if there's any concerns about it, consider another option of contraception for her. And it's really weighing the risks and benefits because so it's really weighing the risks and benefits. Yeah, it's really weighing the risks and benefits because laparoscopic tubal ligation is not a benign procedure. It is major invasive surgery. There's always the risk of injuring bowel, other organs in the pelvis. There's the risk of general anesthesia. So that's why it is so important that women see a healthcare provider who is well-trained, well-versed in Assure and laparoscopic tubal ligation and can sit down and very clearly counsel her on the risks and benefits of both options. And then both of them decide together what is going to be best and safest for her, with the understanding that each one does have a risk of adverse events and that something could happen. Mm-hmm. Yeah, I mean, that is such an important thing for everyone out there to understand. This is not the same kind of nickel that is in jewelry, piercings, anything like that. This is high-grade medical quality nickel titanium alloy. It is the same components that are used in a multitude of medical devices, such as cardiac stents, heart valves, other devices that are used to close holes that are in the heart from when a person is born, orthopedic. I mean, it goes on and on and on. These materials have been used for decades, extensively studied, well known, well understood. It is not the same nickel that you get in jewelry or anything out there. The other thing, too, that everybody has to understand is that these implants are very, very small and that only a very little amount of nickel is leached out from them inside the body. But again, that does not mean that somebody could not have a reaction to it. That's the nature of medicine, and each person in the world is going to be slightly different. And again, it gets back to the counseling, the patient selection. If she has any concerns about it, then it's not the most ideal method. But it has to be a conversation with the healthcare provider and the patient to determine that. I'm sorry, say that again? No, I mean, first of all, Lucy, I want to thank you very much for giving me the opportunity to come on camera and to tell our side of the story. I can say this, that Bayer is very proud to have this device in our portfolio for contraception. It is a fantastic option. When you speak to any trained physician out there who understands Assure, who has gone through our training program, who has a lot of experience with it, they will all say the same thing. It is a great option. It's got data that has proven its safety and efficacy. There are adverse events. There's ways to manage them. You have to counsel the patient. You have to set the right expectations. But there are hundreds of thousands of women out there who have received Assure and are very happy and satisfied with their decision to choose that method as their method of permanent contraception. Thank you so much. Appreciate it, Lucy. You take care.